Sarah thought her 52-year-old brother was just having a bad week. He'd forgotten their mother's birthday, couldn't remember conversations from the day before, and kept insisting he'd had lunch at a restaurant that had been closed for months. When she gently corrected him, he'd add new details to make his story fit, completely convinced he was telling the truth. Then came the morning she found him collapsed in his kitchen, unable to walk straight, his eyes darting uncontrollably. At the emergency room, doctors used a term Sarah had never heard before: wet brain. Wet brain isn't an official medical term, but it's what people call Wernicke-Korsakoff syndrome, a devastating form of alcohol-related dementia that can strike suddenly and destroy memories permanently. What makes this condition particularly cruel is that it often affects people in their 40s and 50s, not just elderly individuals. Unlike Alzheimer's that develops gradually over years, wet brain can hit fast and devastate families who never saw it coming. The condition involves 2 stages. First comes Wernicke-encephalopathy, causing confusion and coordination problems. Without immediate treatment, this progresses to Korsakoff syndrome, creating severe memory problems where people unknowingly fill in memory gaps with false information that feels completely real to them. Sarah's brother had been drinking heavily for 15 years, but his family focused on liver concerns and never realized his brain was at critical risk. The memory problems seemed minor at first, but wet brain can accelerate rapidly once nutritional deficiencies reach dangerous levels. The path from alcohol to brain damage starts in your stomach. Chronic drinking creates acid erosion that damages the stomach lining, preventing proper absorption of vitamin B1, thiamine. This vitamin is absolutely crucial for brain cell function. Heavy drinkers face a perfect storm. Damaged stomachs can't absorb thiamine properly, plus they're often eating poorly, reducing thiamine intake even further. Meanwhile, alcohol floods the system with sugar while depleting the very vitamin needed to process that sugar in brain cells. Without thiamine, brain cells literally starve and die, even when surrounded by glucose. This creates the memory loss, confusion, and coordination problems that define wet brain syndrome. Sarah's brother was consuming thousands of empty calories from alcohol while his damaged digestive system couldn't absorb the nutrients his brain desperately needed. The tragedy is that this process often goes unrecognized until severe neurological symptoms appear. The early signs of wet brain masquerade as typical alcohol problems, making recognition challenging for families who attribute changes to drinking too much, rather than serious brain damage. Memory problems in wet brain have distinctive characteristics. Confabulation represents the most telling sign. When someone fills in memory gaps with detailed false information they genuinely believe is true. Sarah's brother would describe elaborate conversations that never happened and create complex explanations for events that couldn't be verified. When corrected, he'd seamlessly modify his stories, adding new details that seemed to make everything fit together. Physical signs include unsteady walking, difficulty with coordination, and abnormal eye movements. These indicate that thiamine deficiency is damaging specific brain regions responsible for balance and motor control. If you're finding this information helpful in understanding concerning changes in someone you care about, please hit that subscribe button. Recognizing wet brain early can mean the difference between reversible and permanent brain damage. Alcohol creates brain damage through 2 distinct pathways. Wernicke-Korsakoff syndrome represents acute thiamine deficiency dementia that can develop rapidly but often responds to immediate treatment. The second type involves multiple small strokes caused by alcohol's effects on blood vessels. Chronic drinking elevates cholesterol and creates blood clots that block tiny brain vessels, causing scattered damage over months or years. Unlike dramatic strokes that cause sudden paralysis, these mini-strokes create subtle changes that families often don't notice until the cumulative damage becomes obvious. Someone might seem fine most of the time but show increasing problems with complex thinking or decision-making. Sarah's brother had elements of both conditions, acute thiamine deficiency plus evidence of multiple small strokes occurring over months. This combination explains why his deterioration seemed both sudden and gradual simultaneously. Treatment success depends entirely on timing. Thiamine replacement can reverse acute symptoms when administered immediately, but delays allow irreversible brain damage to occur. Hospital protocols involve high-dose thiamine injections followed by oral supplementation. Sarah's brother received treatment within hours of emergency room arrival. His confusion cleared significantly, coordination improved, and severe memory problems resolved, but some subtle cognitive changes persisted from permanent damage. Alcohol cessation becomes essential for any recovery possibility. Continued drinking prevents thiamine absorption and accelerates further damage through both nutritional and vascular pathways. Recovery expectations must be realistic. While thiamine replacement can reverse acute symptoms, some brain damage may be permanent. However, stopping alcohol prevents further deterioration and allows maximum possible improvement. Prevention focuses on recognizing high-risk situations before irreversible damage occurs. Anyone drinking heavily while eating poorly faces elevated wet brain risk, especially if experiencing frequent vomiting or showing malnutrition signs. Family members should document concerning changes in memory, coordination, or behavior to provide healthcare providers detailed information about symptom progression. Don't dismiss cognitive changes as normal drinking consequences. Emergency intervention becomes necessary when someone shows acute confusion, coordination problems, or abnormal eye movements. These symptoms require immediate medical evaluation and thiamine replacement to prevent permanent brain damage. Sarah emphasizes acting on instincts when something seems wrong. Her family noticed subtle changes for months, but dismissed them as typical drinking problems. Earlier intervention might have prevented permanent damage. Wet brain represents one of the most preventable yet devastating complications of chronic alcohol use. Unlike other dementias, this often affects younger people and can progress rapidly without warning. Cognitive changes in heavy drinkers should never be dismissed as normal drinking consequences. Memory problems, coordination difficulties, and personality changes may indicate serious brain damage requiring immediate medical intervention. In the description below, you'll find links to my book, Navigating Dementia Together, and free resources including home safety checklist, important resources links, and emergency contact list template. Remember, wet brain is preventable, and appropriate treatment can stop progression even after diagnosis. For your next video, I recommend watching our discussion on sleep disturbances in dementia, which often become problematic in alcohol-related brain damage. You might also find value in our video covering wandering behaviors in dementia patients, as spatial disorientation frequently occurs in wet brain syndrome.